If you've been dealing with persistent headaches that won't go away, changes in your memory, or shifts in the way you think, and you don't really understand what's happening, today I want to help you understand why brain cancer can be so difficult to detect and which warning signs you should start paying attention to right now. Throughout my experience as a physician, I've seen many cases where people arrive too late simply because they didn't know how to interpret what their body was trying to tell them. I clearly remember a patient in his 60s who came in thinking it was just stress. He had frequent headaches and occasional confusion. Over time, we realized there was something deeper going on. That's why this topic is so important for you and for the people around you. In most cancer cases, people don't pass away from the original tumor, but from when that cancer spreads to other parts of the body. In other words, the situation becomes more serious when it expands. However, there are certain types of cancer that don't need to spread to cause serious harm, and one of the most delicate is brain cancer. Today, I want to explain in a clear and simple way why this happens, how it is treated, what is known about its progression, and something many people don't realize. Even tumors that are not cancerous can still pose a serious risk when they develop in the brain. There are two key aspects that make this condition so unique. The first is obvious. We are talking about the brain, the control center of your entire body. Any disruption in this area can affect multiple functions, from movement to memory and emotions. The second aspect is less obvious but just as important: space. The brain is protected inside the skull, which is a rigid structure. Unlike other parts of the body where tissues can shift or adapt, here there is no room. When a mass begins to grow, it starts pressing against everything around it. To help you visualize this, imagine that the brain is wrapped in several protective layers called the meninges. The outermost layer is strong and resistant, designed to protect. Beneath it is a thinner, more delicate layer, and between them there is a special fluid that acts like a cushion, protecting the brain from impacts and sudden movements. This fluid allows your brain to remain suspended and protected inside the skull. However, when a tumor develops, that balance is disrupted. Pressure begins to build, and that's when symptoms can start to appear. Something very important you should know is that the brain itself does not directly feel pain. That's why many problems go unnoticed at first. But the layers surrounding it do have sensitivity. So when a tumor begins to press on these structures, you may start to feel discomfort, such as persistent headaches. In addition, there are tumors that do not originate directly from the brain, but from these surrounding layers. Even so, they can produce similar effects because they take up space and create pressure. In fact, they are quite common, and even when they are not malignant, they should not be taken lightly. That is why it is so important to start listening to your body. Many signals may seem small or unimportant at first, but understanding them can make a significant difference. And if this information is helping you see your health more clearly, I invite you to subscribe to the channel and share this content with someone who may need it. Sometimes, a simple video can help someone take action at the right time. Now, let's go deeper so you can better understand why some brain tumors are especially difficult to detect and treat. Let me explain something in a very simple way. When we talk about a tumor, we are referring to an abnormal growth of cells in the body. These tumors can be either benign or malignant. In general, benign tumors are less aggressive. They tend to be more contained, almost like they are encapsulated, and they do not easily invade nearby tissues or spread to other parts of the body. On the other hand, malignant tumors are more aggressive. They invade surrounding tissues, damage them, and have the ability to spread to other areas of the body. That is why malignant tumors are considered cancer. When a tumor is detected, one of the most important tests is a biopsy. This helps determine whether the tumor is benign or malignant. Naturally, everyone hopes to hear that it is benign. However, here is something many people don't know, and something I've had to explain many times in my practice. In the brain, even a benign tumor can become a serious problem. Because of the space issue we discussed earlier, the skull does not expand. It does not give way. So any growth, even a non-cancerous one, can press against brain tissue and cause significant complications. I remember a patient who came in feeling calm because she had been told her tumor was benign. She thought there was nothing to worry about. But over time, she began experiencing dizziness, balance issues, and difficulty concentrating. It wasn't the type of tumor, it was where it was located. That pressure inside the skull can change everything. Now let's take this a step further so you can understand why some brain tumors are especially complex. The brain is mainly made up of two types of cells. On one side, there are neurons, which are the most well-known. They are responsible for sending electrical signals and enabling communication within the brain. Thanks to them, you can think, remember, move, and feel. To give you an idea, you have tens of billions of neurons, and each one can connect with thousands of others. This creates an incredibly complex network that makes everything you are possible. But your brain is not made up of neurons alone. There are also glial cells. These cells play essential roles. They support neurons, protect them, nourish them, help maintain balance in the brain, and even participate in the immune defense of the nervous system. Now here comes a very important difference, and this is where you should pay close attention. Neurons generally do not divide. In other words, they do not constantly reproduce. However, glial cells do divide frequently. Why does this matter? Because tumors form when cells begin to divide uncontrollably. So cells that naturally divide have a higher chance of becoming dysregulated if there is a problem in their genetic information. This is why certain brain tumors originate from these glial cells. And one of the most well-known and aggressive types is glioblastoma. This type of tumor behaves very differently from others. While some tumors grow from outside the brain and press inward, glioblastoma develops within the brain tissue itself. And here lies the major problem. It does not form a clear, well-defined mass. Instead, it infiltrates. It spreads between cells, almost like roots. This makes it much harder to detect clearly and much more difficult to treat. In my practice, I have seen cases where, even after multiple tests, it was not easy to define the exact boundaries of the problem. And that delays important decisions. So I want you to remember this. Not all tumors behave the same way, and understanding these differences can help you make more informed decisions about your health or that of someone close to you. Now, let's talk about why this type of tumor remains such a major challenge, even with today's advanced treatments. Unlike other tumors that may have clear boundaries, glioblastomas do not. They spread through the brain like roots growing through healthy tissue, making it extremely difficult to distinguish where the tumor ends and normal brain begins. This creates one of the biggest challenges in treatment. When planning how to treat a tumor, doctors must carefully evaluate several factors: its location, size, growth rate, whether it is benign or malignant, and most importantly, whether it can be safely accessed without damaging critical areas of the brain. In many cases, surgery is one of the main treatment options. The goal is to remove as much of the tumor as possible. When tumors are well defined, especially those growing from outside the brain, it may be possible to remove a large portion or even all of it. But when tumors grow within the brain tissue and infiltrate surrounding areas, the situation becomes much more complex. Even if everything visible is removed, microscopic cells can remain and later grow again. This is something I have seen in patients who initially felt hopeful after surgery, only to experience symptoms returning months later. I remember one patient who, after surgery, felt optimistic and improved for a while. But then symptoms slowly came back. It wasn't that the treatment had failed, it was the nature of the tumor itself, which makes complete removal extremely difficult. That is why additional treatments such as radiation therapy and chemotherapy are often used. Radiation aims to damage tumor cells using targeted energy, while chemotherapy uses medication to slow or stop their growth. These treatments are often combined to improve outcomes. However, one issue remains constant: space. As the tumor grows, pressure inside the skull increases. This pressure can compress vital structures, disrupt blood flow, and interfere with normal brain function. That's when symptoms you should never ignore may appear: persistent headaches, seizures, difficulty thinking clearly, weakness in parts of the body, or even changes in personality. Everything depends on the area of the brain affected. When it comes to prognosis, it's important to be honest, but also realistic. Some tumors, like glioblastoma, remain highly aggressive and difficult to treat. Even with intensive treatment, survival time is often limited. But that does not mean treatment is pointless. It can extend life, reduce symptoms, and improve quality of life. On the other hand, tumors like meningiomas often have a better outlook, especially when they can be surgically removed. Still, outcomes depend greatly on their size and location, because even a benign tumor can cause serious problems if it presses on critical areas of the brain. I want you to remember one key idea. When it comes to the brain, what matters most is not just the type of tumor, but where it is located. Inside the skull, space is extremely limited, and even small changes can have significant consequences. If this content has helped you better understand your health or the health of someone close to you, I sincerely invite you to subscribe to the channel, turn on notifications, and share this video with others. Someone around you might need this information right now. I would also love to read your thoughts in the comments or know what topics you would like me to cover next. Before we finish, I want to invite you to take a moment to be grateful to God for your life, for your body, and for the opportunity to learn how to take better care of your health. Sometimes we take the most important things for granted, and this kind of knowledge can truly make a difference. On this channel, Dr. Gabriel Mena is truly grateful to support you with clear, practical information to help you improve your well-being every day. Tomorrow, there will be a new video created especially for you, so I invite you to come back and continue learning how to live a healthier, better life.